Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear an optometrist talking to a patient called Mr. Lucas. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hi, Mr. Lucas. Your GP referred you to me after you mentioned having issues with your vision, particularly at a distance. Can you tell me more about what you've been experiencing?
Yeah, so I've been having trouble seeing things clearly when they're far away. It's been going on for a while now, maybe about 6 months. I first noticed it when I was driving. The road signs would just blur out, and I'd have to squint to make out the letters. I thought it might just be tiredness, but it's getting worse, especially in the evenings.
I see. So it sounds like you've been struggling with distance vision for quite some time. Has it been affecting other areas of your life as well?
Definitely. At work, it's become a bit of an issue. I work in an office, and although my computer is fine because it's close, during meetings, if there's something projected on the screen, I can't read it clearly unless I sit in the front. Watching TV is also harder now unless I'm sitting closer than I used to.
Okay, so it's more than just occasional trouble, and it's starting to impact your daily routine. Have you had any vision problems before this, or is this the first time you've noticed anything?
No, I've never had any issues with my eyes before. I mean, I always had perfect vision, at least that's what I thought. I guess I've taken it for granted because this has been a bit frustrating.
I understand that. Nearsightedness, or myopia, can develop gradually, and often people don't notice it until it starts interfering with daily activities like driving or work. From what you've described, it sounds like you may have developed mild to moderate myopia. Have you had any headaches or eye strain, especially after trying to focus on distant objects for a while?
Yeah, actually, now that you mention it, I've had quite a few headaches. They tend to come on later in the day, especially after I've been driving or if I've been in a meeting where I had to strain to see something far away. My eyes feel tired a lot too, like I've been using them too much or something.
That's pretty common with myopia. The headaches and eye strain come from the effort your eyes are making to focus on distant objects. It's like they're working overtime to adjust. Do you find yourself squinting a lot?
Oh, constantly. It feels like it helps, but I guess it doesn't really do much. I've tried just ignoring it or adjusting things, but it's hard to function properly when everything far away looks blurry.
Squinting can temporarily help because it changes the shape of your eye slightly, allowing more focused light to hit the retina, but it's not a long-term solution. So let's talk about solutions. Have you considered glasses or contact lenses?
I've thought about it, but I've never worn glasses before. I guess I've been a bit reluctant. I don't really like the idea of having to wear something on my face all the time, and contacts seem like they'd be a hassle.
That's a very common concern. Glasses today come in many lightweight, stylish options that don't feel heavy or uncomfortable. They're also easy to adjust to. As for contacts, many people find them convenient once they get used to them. It really depends on your personal preference and lifestyle. We can discuss both options further and see which feels right for you.
I guess I'd be open to glasses, but contacts still seem intimidating. What would you recommend, though? Is there a specific type that would suit my situation better?
For mild to moderate myopia like yours, glasses are typically the first and most straightforward option. You can wear them when you need them, like for driving, watching TV, or in meetings. There's no pressure to wear them all the time unless you want to. As for contacts, they offer more flexibility for those who prefer not to wear glasses full-time, and they've come a long way in terms of comfort. You can try daily disposables, which are single-use and very low maintenance.
That doesn't sound too bad. I think I'd like to start with glasses and maybe try contacts later once I get used to it all. I just want something that will make daily life easier again.
That's a great plan. We'll do a full eye exam today to determine the exact prescription you'll need. Based on your description, it sounds like a mild prescription should help you see things clearly again without strain. Once you start wearing the glasses, you'll notice the difference immediately, especially with tasks like driving or reading things from a distance.
I hope so. It's been frustrating, especially when I'm driving. I've had to ask passengers to read signs for me a few times, which is embarrassing.
You'll feel a lot more confident behind the wheel once you have the correct lenses. If glasses don't feel like the right fit later on, we can always explore contact lenses or other options like LASIK surgery, but
Extract 2, questions 13 to 24. You hear a doctor talking to a patient called Mr. Collins. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Mr. Collins. I'm Dr. Sarah O'Neill. What brings you in today?
Hi, Doctor. I've been feeling really off for the past few months. I'm always tired, like all the time, no matter how much I sleep. I get dizzy sometimes too, and even simple things like walking upstairs leave me out of breath.
That sounds concerning. Let's try to get to the bottom of it. Has anything changed recently, like your diet or lifestyle? Have you experienced any other symptoms besides fatigue and shortness of breath?
Well, now that you mention it, I've noticed my skin is paler than usual, and I've been getting headaches more often. As for my diet, I guess I haven't been eating as well as I used to. My job's been hectic, so I'm skipping meals or just grabbing whatever's quick.
Fatigue, dizziness, shortness of breath, pale skin, and headaches could be signs of anemia. You mentioned your diet has changed. Sometimes vitamin deficiencies can lead to anemia, particularly deficiencies in vitamins like B12 or folate. Are you familiar with vitamin deficiency anemia?
Not really. I've heard of anemia but didn't know vitamins had anything to do with it.
Vitamin deficiency. Anemia happens when your body doesn't have enough of certain vitamins it needs to produce red blood cells. Without enough healthy red blood cells, your body can't get the oxygen it needs, which leads to the fatigue and other symptoms you're experiencing. In many cases, it's due to a lack of B12 or folate, which are essential for red blood cell production.
Oh, that makes sense. I guess I haven't been eating as many fruits and vegetables lately, and I've cut back on meat too.
Those are key sources of B12 and folate. Meat, dairy, and eggs provide B12, while folate is found in green leafy vegetables, beans, and fortified cereals. A deficiency in either of these can cause your symptoms. Have you had any issues with digestion? Conditions like celiac disease or Crohn's can make it harder for your body to absorb these vitamins.
No, I don't think I've had any digestive problems, but I do take some over-the-counter antacids regularly for heartburn. Could that be related?
That could be a contributing factor. Long-term use of antacids can affect your stomach's ability to absorb B12. Your stomach needs acid to absorb this vitamin properly, and if you've been taking antacids regularly, it could be reducing the amount of B12 you're able to get from your food.
Wow, I had no idea. So what can I do to fix this?
The first step is confirming the diagnosis. I'll order some blood tests, including a complete blood count CBC and tests to measure your B12 and folate levels. If the results show vitamin deficiency anemia, we can work on getting your levels back up. Treatment usually involves dietary changes, and in more severe cases, vitamin supplements or even injections.
Injections? That sounds serious.
Injections are typically used if oral supplements don't work, or if your body has trouble absorbing vitamins through your digestive system. But in many cases, dietary adjustments and supplements are enough. For example, we might recommend adding more B12-rich foods to your diet, like meat and dairy, or folate-rich foods like spinach and lentils.
I see. So it's not something I'll have to deal with forever?
In most cases, no. Once your vitamin levels return to normal and you maintain a balanced diet, the anemia should resolve. However, it's important to follow up regularly to ensure that your body continues to get what it needs. Some people, especially older adults or those with certain medical conditions, may need ongoing supplements to prevent a recurrence.
Okay, that sounds manageable. I guess I should pay more attention to what I eat.
It's definitely something to consider. A balanced diet can go a long way in preventing vitamin deficiencies. In the meantime, we'll wait for the blood test results to confirm whether this is the cause. If it turns out to be vitamin deficiency anemia, we'll get you started on a treatment plan right away. It's good that you came in when you did. Anemia can become more serious if left untreated.
Yeah, I'm glad I came in too. I was starting to worry something more serious was going on.
It's always best to check in when you're feeling unwell. Anemia, especially from vitamin deficiencies, is treatable, but it's important to catch it early. I'll follow up with you as soon as the test results are in and we'll take it from there.
Thank you, Doctor. I appreciate it.
You're welcome, Mr. Collins. We'll get you feeling better soon.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a medical professional explaining a diagnostic procedure to a colleague. Now read the question.
Dr. Harris, I have a question about the 45-year-old woman's skin biopsy report.
Sure. Have you reviewed the pathology report?
Yes, I have. The report shows atypical melanocytes in the epidermis, with irregular nests extending into the dermis. Doesn't this confirm the diagnosis of melanoma?
Yes, it suggests melanoma, but there's another important factor here. The patient's history of significant sun exposure and noticeable skin changes over the years strengthens this diagnosis. You must consider the clinical context alongside the pathology.
Right, I hadn't fully accounted for the patient's history.
Look at question 26. You hear a surgeon discussing about a patient. Now read the question.
Around the incision site, but it's manageable with the painkillers prescribed. He seems stable.
Good. I've added some notes regarding his recovery. We need to keep an eye out for any signs of infection, especially redness, swelling, or discharge around the incision. His fever should also be monitored closely over the next 24 hours.
Understood. I'll make sure the team is aware to watch out for any symptoms of infection.
Great. Also, ensure his pain is managed effectively but not over-medicated. We want him mobile as soon as possible to prevent any complications with his recovery. If there's any significant increase in pain or fever, call me immediately.
Absolutely. I'll make sure he's monitored closely for both infection and pain control.
Thanks. Let me know if anything changes.
Now look at question 27. You hear a medical professional explaining ICU handover process. Now read the question.
Thank you for being here today. As we have discussed before, the ICU handover process follows a structured format. Patient details, current ventilator settings, sedation protocols, infection control measures, and overall care plan. Each section of the handover should be concise yet comprehensive, for example, when discussing ventilator settings. It's not necessary to cover every technical parameter unless it's clinically relevant to the patient's condition. You should mention key aspects, like the fact that the patient is currently on 40% FiO2 and 8 PEEP. Additionally, if there's been a change in the patient's oxygenation, or if they have failed any weaning trials, this should be included. When you move on to sedation protocols, it's important to note whether the patient is currently on propofol or midazolam, and mention the sedation goals, like keeping the patient calm but not over-sedated. Then, for infection control, ensure to include relevant details like whether the patient is on contact precautions due to MRSA, or if they've had recent blood cultures showing signs of sepsis. Finally, when summarizing, mention if there are any ongoing concerns or changes in the treatment plan, such as discontinuing sedation for a spontaneous breathing trial.
Now look at question 28. You hear a neurologist explaining to a patient about her recent speech changes. Now read the question. Doctor, I'm really worried. Ever since the accident, my speech has changed. Everyone says I sound like I'm speaking with a different accent, but I've never lived anywhere else.
Yes, I understand your concern. This condition is known as foreign accent syndrome. It's very rare and can occur after brain trauma, like the one you had in the accident. The speech centers in the brain are affected, which changes the way you pronounce words.
But I don't feel any different otherwise. Is this something permanent?
It's difficult to say. In some cases, patients recover as their brain heals, while in others, the speech changes can persist. The good news is that we can begin speech therapy to help you regain more control over your pronunciation.
Now look at question 29. You overhear a conversation between two doctors discussing delays in lab results. Now read the question.
It's been such a frustrating day.
I can imagine. You must be exhausted dealing with all these delays. What exactly is the issue?
Well, the lab results are taking far too long to come back. In theory, most of the tests are supposed to take about 30 minutes, but today, they've been taking over 2 hours.
That's crazy. I assume this is backing up everything else in the department.
Exactly. The patients are waiting far too long for diagnoses, and that means we can't make any decisions about discharges or treatments. Everything is grinding to a halt.
And I guess this isn't just affecting the emergency cases, but even the patients already admitted, right?
Yes, it's awful. The patients waiting in the department for test results, as well as those waiting in other parts of the hospital for follow-ups, are all getting delayed.
And with the department full, this must be having a ripple effect on patient care throughout the hospital.
It definitely is. The lab delays are throwing off everything.
So what's causing the delays?
Now look at question 30. You hear a veterinarian and the owner of a dog discussing the importance of performing a necropsy. Now read the question.
Necropsy can be so helpful in understanding what happened to Rocky. Okay. A necropsy is very similar to an autopsy, but it's performed on animals. It helps us understand the cause of death and can sometimes reveal underlying diseases that may not have been detected while the animal was alive. In Rocky's case, performing a necropsy could help us learn if there was an undiagnosed condition or if there were any complications that led to his unexpected passing.
I see. And what do you do during the necropsy?
During the procedure, we examine the internal organs, tissues, and sometimes take samples for further laboratory tests. This can help identify any infections, cancers, or even confirm if there was something genetic that we didn't pick up on earlier.
Would it also help if there was something contagious?
Absolutely. One of the most important reasons to do a necropsy is to identify any infectious diseases. If we find something like that, it could help protect other animals, especially if Rocky had any contact with them. So, necropsies are often crucial in preventing outbreaks.
That makes sense. I didn't realize how important it could be. That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear a doctor giving a detailed presentation on nutrition and liver health. You now have 90 seconds to read questions.
Hello everyone. Thank you for inviting me to discuss a very relevant and growing concern in public health today. Nutrition and liver health, particularly in the context of liver diseases like non-alcoholic fatty liver disease, NAFLD, and cirrhosis. These conditions have become alarmingly common, partly due to modern dietary habits and lifestyle factors. To give you a sense of the scale, NAFLD is currently the most common chronic liver condition in the world. In the United States alone, it's estimated that between 25% to 30% of adults have some form of NAFLD. Globally, similar figures apply, and the rates are even higher among people with obesity and type 2 diabetes. This is particularly concerning, as NAFLD can progress to more severe conditions like cirrhosis, liver failure, or even liver cancer. Cirrhosis, on the other hand, is the result of long-term damage to the liver. It causes scarring, which leads to poor liver function and can develop due to various causes, including viral hepatitis, alcohol abuse, and increasingly, NAFLD. It's important to note that cirrhosis is the final stage of many chronic liver diseases. Now, before delving into the main topic of today's discussion, how nutrition impacts liver health, let's quickly review the vital role of the liver. As you might know, the liver plays a crucial part in detoxifying the blood, metabolizing nutrients, producing proteins essential for blood clotting, and storing important vitamins and minerals. The liver is remarkably resilient and can regenerate itself, but when it's consistently damaged by poor diet, alcohol, or other toxins, its ability to heal itself diminishes over time. NAFLD, as the name implies, is not caused by alcohol, but is largely influenced by diet and metabolic health. It is strongly associated with excess fat accumulation in the liver, which triggers inflammation and oxidative stress, leading to liver cell damage. As a result, one of the most effective ways to combat and manage NAFLD is through dietary intervention. It is well established that adopting a balanced, nutrient-dense diet can significantly improve liver function, reduce inflammation, and help prevent further damage to the liver. So, what dietary strategies are particularly beneficial for liver health? One approach is reducing the intake of refined carbohydrates and sugar. Studies have shown that excessive sugar, particularly fructose found in sugary beverages and processed foods, plays a key role in fat buildup in the liver. This is why we recommend a diet rich in whole foods like vegetables, whole grains, and lean proteins, while minimizing the consumption of processed foods and high-sugar snacks. Fats also play a major role in liver health. While it's important to limit saturated fats found in processed meats and fried foods, not all fats are bad for the liver. In fact, healthy fats, such as those found in olive oil, avocados, and fatty fish like salmon, can be protective. These fats contain anti-inflammatory properties, which help reduce liver inflammation. Omega-3 fatty acids in particular have been shown to decrease liver fat and inflammation in people with NAFLD. Another crucial component of liver-friendly nutrition is antioxidants. Antioxidants help fight oxidative stress, which is a significant contributor to liver damage. Foods high in antioxidants, such as berries, green tea, nuts, and leafy greens, should be staples in a liver-healthy diet. One of the most well-researched antioxidants for liver health is vitamin E. This vitamin has been found to reduce liver inflammation and fat accumulation in people with NAFLD. Next, I'd like to mention alcohol. As you know, excessive alcohol consumption is a major cause of liver disease, particularly cirrhosis. For people at risk of liver damage, reducing or eliminating alcohol is key to preventing further progression of liver conditions. Even moderate drinkers should be cautious, as regular alcohol intake can contribute to liver fat accumulation and hinder liver function. Now that we've covered the importance of diet, let me briefly talk about lifestyle factors. Regular physical activity is another important component of liver health. Exercise helps to reduce liver fat and improve overall metabolic health. Studies show that even moderate exercise, like walking or cycling, can have a positive impact on liver function. In summary, the key to supporting liver health is adopting a holistic approach that includes a nutrient-rich diet, regular exercise, and limiting or avoiding substances that harm the liver, such as sugar and alcohol. While these changes might seem challenging at first, they can greatly improve liver function and overall well-being.
Extract 2. Questions 37 to 42. You hear an interview with Dr. Michael Jameson discussing harm reduction strategies. Now, read the questions. You now have 90 seconds to read questions.
Today we're discussing the ongoing opioid crisis and two major approaches to tackling it: harm reduction and zero tolerance policies. My guest is Dr. Michael Jameson, a public health expert and professor at the University of Washington, who has extensively studied these different approaches. Dr. Jameson, thanks for joining us. Let's start with an overview. What are harm reduction strategies and how do they differ from zero tolerance policies?
Thanks for having me. Harm reduction is an approach that focuses on minimizing the negative health, social, and legal impacts of drug use, without necessarily requiring abstinence. One of the most prominent examples is the establishment of supervised injection sites, where individuals can use drugs in a medically supervised environment. The goal is to reduce the risk of overdose, prevent the spread of diseases like HIV and hepatitis, and provide an entry point for health services. On the other hand, zero-tolerance policies aim to eliminate drug use entirely. This is done through strict law enforcement, mandatory minimum sentencing for drug-related offenses, and an emphasis on punishment rather than treatment.
These seem like very different philosophies. What does the research say about which approach is more effective in reducing the harm caused by opioids?
They are very different, yes. The research shows that harm reduction strategies can significantly reduce overdose deaths and the transmission of infectious diseases. Studies have shown that people who use supervised injection sites are far less likely to experience an overdose or contract a disease from shared needles. They're also more likely to engage with healthcare providers and seek treatment when they're ready. Zero-tolerance policies, on the other hand, have not been shown to reduce overall drug use or improve health outcomes. In fact, there's evidence that strict enforcement can drive drug users underground, making it harder to reach them with healthcare services. The result is often more overdose deaths and higher rates of disease transmission. While zero tolerance might seem like a straightforward solution, it often exacerbates the problem.
It sounds like harm reduction has some clear benefits, but what do critics of this approach say?
Critics of harm reduction argue that these strategies can normalize drug use. They believe that offering services like supervised injection sites sends the wrong message, that it's acceptable to use dangerous substances. Some also believe that these approaches fail to address the root of the problem, addiction itself, and may deter people from seeking treatment because they can continue using drugs in a safe environment. The proponents of zero-tolerance policies argue that the only way to truly solve the opioid crisis is by eliminating drug use through stronger law enforcement and a focus on prevention and abstinence. They claim that harm reduction only offers a short-term solution, whereas zero-tolerance focuses on long-term change.
Are there any compromises between these two approaches?
There are some programs that combine elements of both. For example, law enforcement-assisted diversion-led programs allow police officers to redirect drug users to treatment instead of jail. This combines the enforcement aspect of zero tolerance with the public health focus of harm reduction. Similarly, some areas have adopted syringe exchange programs alongside stricter laws around drug distribution. What's important to remember is that drug addiction is a complex issue that isn't solved by a one-size-fits-all solution. A blended approach may work better in some communities, addressing both the public health and law enforcement aspects of the crisis.
It seems like the conversation around these two approaches is evolving. Where do you see the future of opioid policy going?
I think we'll continue to see more emphasis on harm reduction, especially as the data continues to show its effectiveness. The opioid crisis has highlighted the limits of punitive approaches. The legal system can only do so much, and we need to focus on public health interventions that reduce harm in the short term and connect people to long-term treatment solutions. But I don't think zero tolerance will disappear completely. It has strong political backing, particularly in regions that have been hit hard by the opioid epidemic. I expect to see more integration of these strategies in the future, with policymakers trying to balance public health needs with community concerns about crime and safety.
Do you think stigma plays a role in how these policies are viewed and implemented?
Absolutely. There's a huge stigma around drug use, and that often influences policy. Harm reduction approaches, like supervised injection sites, face significant public opposition because people don't want these services in their communities. Even though the data shows they reduce harm, the stigma around drug users persists. On the other hand, zero-tolerance policies often appeal to people because they seem like a tough, decisive action against a problem that is seen as morally wrong.
That's an interesting point. It seems like overcoming stigma could be a major challenge for harm reduction strategies moving forward.
Yes, stigma is definitely a barrier. But with more education and evidence-based policymaking, there's hope that the public's view on harm reduction will shift. We've seen similar shifts in other public health areas over time, like HIV prevention and mental health, so I think it's possible.
Thank you so much for your time, Dr. Jameson. This has been a really enlightening conversation.
Thank you for having me.
That is the end of Part C. You now have 2 minutes to check your answers.